What is good, my TikTok family and friends? I am almost 2 weeks post-op VSG, and I have my virtual follow-up appointment with my surgeon's nurse practitioner and my nutritionist, and I will take you along. First appointment is going to be at 2:30 to check in with the nurse practitioner, and then at 3 o'clock I will be checking in with the nutritionist. So let's see how this goes, y'all. Hi, how are you?
Doing just fine. More importantly, how are you doing?
I feel amazing. I'm feeling really good. I'm feeling really good. I'm having more energy. I'm just feeling really good overall.
Yay!
Getting down my liquids, doing anywhere from 65 to 75 grams of protein. Been getting my liquids in, been going for my walks, and I'm just feeling really, really good.
Damn, girl, kicking my ass over here.
And I've been doing yogurt in the morning because, you know, I take medicine for my gallbladder and was it omeprazole for the stomach acid. So I break down the powder form and the pill, and I put that in my Greek yogurt, which has about 15 grams of protein, and I slowly eat that for about 45 minutes from my baby spoon. So I get my first dose of medicine in that way. And then I wait about another 30 minutes, and then I put my other medicine in there and eat it. So that's what I'm doing, how I'm taking my medicine right now. Because the capsule for the gallbladder is a little bit bigger, so I have to open it up and put the powder in there.
Okay. Are you breaking open the heartburn medicine, the esomeprazole?
No, I'm actually able to swallow that one.
Okay.
Because it's a smaller pill. I have no problem swallowing that one. That one's so easy. It just goes down nice and smooth.
Are you having any problems with heartburn?
No problems with heartburn. My bowel movement's great. I've been going to the bathroom every TMI, but I've been having my bowel movement once a day, every day. No constipation. That's what I was a little bit nervous about because I was like 4 days post. I'm like, girl, am I even gonna have a bowel movement? And have to email my surgeon. He's like, and then Amy, I think the nurse or the medical assistant, yeah, she got back to me and she let me.
OR, but you can definitely worsen that pain as you become more active. So just kind of watch it and keep an eye on it, okay?
So I've been walking, you know, about 4 or 5 times a day, and the reason why I do that is to just be active. It's just around my apartments from the front to back, and then we have Starbucks right there, so I go walk in the morning, just get me a cup of ice, just to keep myself busy after the kids, you know, go to school, and I just go get a cup of ice and pour my protein in there.
About the damn gym right now, my biggest concern is, are you eating, are you drinking, are you throwing up? You see how hard it can be to get all of that in, right?
Yeah, so I think it's just more time management. I really just, Dr. Schneider really stressed to me when he came and see me after surgery. He said, Vanessa, you know, every 15 minutes. So that's what I've been doing with my water. You know, by 8 or 9 o'clock, I have all my liquids in, my protein in. What I've been doing, that's what I've been doing.
That's wonderful. And then you're seeing Sarah today at 3.
Yeah.
So she'll go over your soft food diet and so forth. Okay.
Will I go through a puree stage, or is it just straight to soft food?
Whatever you're comfortable with.
Okay.
Okay. Sometimes people gotta do some purees and before they can go to soft foods.
Okay.
Seems like you're doing so well that you could probably just go to softs.
Okay.
Any problems with nausea? I mean, I'm assuming sounds like you're not having any problems with nausea.
Okay, so let me tell you, I think I have some full cues. Okay, so if I'm eating, let's say when I'm eating my yogurt, my nose runs like on the left side. I know it starts to run, or if I know that I'm doing too much, I start to feel a little sick. Like if I'm eating and my nose starts to run, and if I take that last bite, I notice, okay, I feel a little nauseous, and then after I stop, when that nose runs, I feel a little nauseous, I stop. 5 minutes later, I feel better, and then I just go back to an hour later or 2 hours later.
Yes.
So I'm thinking those are my fuel cues. My body's like, girl, what are you doing? You need to stop.
Yes. So runny nose, nausea, those are all signs of fullness. And I know you're like, there's no way in hell I can be full. I hardly even ate.
Yeah.
I know. Those are signs of fullness. So I'm glad you're listening to that.
Yeah, but with the liquids, because I'm doing every 15 minutes, I don't ever full of fullness. I just feel like I'm okay. Like I feel satisfied. Like when I'm done with my protein, I notice that I'm drinking every 15 minutes. It takes me anywhere from an hour to 2 hours, depending how my body feels. But after that, I just kind of give myself a break once I finish that protein and I wait an hour, and then I go to my water because I feel not fullness, just satisfied. I can feel it, you know.
Yeah, it's easier because water's just light. It doesn't like get heavy. Like I get it.
So in that tightness right here that I had to, it's completely like went away. I don't know if it's normal, but I have no problem like drinking my water. I had some tightness I was worried about. I think the day after surgery, it was really hard for me to get down liquids and protein. That's went away. I don't feel that no more. The soreness in my throat is gone. But the doctor had told me that it's because, you know, they stick the tubes down there. It has some soreness, but that's gone now too.
Good. Wonderful. Yeah, it really sounds you're doing awesome after surgery here. Have you started your vitamins yet?
No, I was told not to do that until I see you guys 2 weeks after, but I did get my vitamins.
Okay.
I have my Berry Life. I have my multivitamin with iron.
Celebrate, okay.
And then I have some biotin. I'll talk to the nutritionist about that. And then I have this calcium chews, these Berry Life chewables.
You bought a separate biotin?
Huh?
You said you bought a separate biotin?
Yeah, it's like a berry melt. Somebody had recommended to me, so I went to talk to it's a berry melt.
Girl, you don't need that crap.
Okay, is that just like money that I don't need, that I'm just overspending? Because I was concerned about hair loss. I was talking to the doctor. I mean, I have a lot of hair, but, you know, I was concerned about hair loss. So that's why somebody had recommended, like, well, you know, talk to your doctor and get a berry melt for biotin.
Girl, look at your multivitamin. Look at the ingredients label on that and look at your multivitamin. It is the same shit.
Okay. So basically, I'm just wasting money.
Yes.
Well, I'm glad you told me, because I do not want to be wasting money being a mom with all these kids, so.
No, I understand. No. I mean, there's nothing you can do to prevent hair loss. If there was something you could do from day one of our appointment, I would tell you, buy this, buy this, buy this, and you'll thank me later. Like, there's nothing you can do to prevent hair. If it happens to you, not everyone goes through that hair loss stress response, okay?
Okay.
If you do develop any hair loss, best thing you can do is take your multivitamin, but focus on that protein intake that you're doing. Nourish your body from within to help snap out of it.
Okay.
Think about it this way, like, even without surgery, you can have just a really crappy diet, let's say junk food, fast food, and you can have a weak, brittle nails and brittle hair just by eating a crappy diet, right?
Right.
But if you're actually eating your protein and getting your carbs and getting your fiber and fluids in from within, you'll snap your body out of that phase and it'll heal up. Does that make sense?
Yeah, so as long as I have a really good routine and regimen of getting my nutrition and protein, I should do really well. Okay.
Yeah. Because you're not going to prevent it, but it'll last shorter and snap your body out of it.
Okay. So like right now, my goal is the 90 grams of protein. I'm doing about 75 right now.
Wonderful.
Okay. I'm sure eventually I get there. I'm like, I don't want to be too hard on myself. I'm like, as long as I do the minimum of 60, but I try to push myself. I'm like, okay, you can do 60. Let's try for 70 or 75. But now I can easily do 75, like, without a problem.
It worsens that incisional pain, back off, give your body more time to heal. Does that make sense?
Yeah. How long does the body typically, it just probably really depends on the patient or person, huh?
Yeah, the more sickly the patient, the longer it takes to heal.
Okay. The doctor had told me, he said, I'm not too worried about you. You're pretty young. He's like, you're pretty healthy. He's like, I think you're going to do really good. That's what they were telling me. And they anticipated pretty right, because I am feeling really good, so.
Exactly, because you're providing your body the nourishment, the surgery. I don't know anyone who has not had that regret, like, what did I just put myself
Exactly.
Your body, if you're doing something that hurts or whatever, back off,
Okay, you guys, so that was the first part of the appointment. That was with my surgeon's nurse practitioner. She just follows up with me to make sure I'm doing okay, if I have any questions, telling me what to expect after surgery, and I'm doing really, really well, more than most patients do, so they're not too worried about me, so that's really awesome. I feel really great about that. So the second part of my appointment, follow me for part 2 with my dietitian.